So we are here today at the SWAC ELSO, the 11th Annual Conference 2025. My name is Naduko, the guest correspondent for the podcast. And today we'll be introducing Mohamed Azzam. Could you please introduce yourself and tell us a little bit about you?
Thank you very much. My name is Mohamed Azzam. I'm a emergency ICU trauma ECMO doctor from Saudi Arabia, born and raised. I work at Dr. Sulaiman Al Habib Hospital, which is a big medical private sector group. And we are one of the ECMO centers, and we're glad to be a registered ECMO center this year.
Congratulations.
Thank you very much. And this is one of the things that we are proud with SWAC ELSO, since it started almost in 2014, I guess. And this family is just growing and growing and growing, and we're really proud. Even to that, the private sectors are interested to have this kind of accreditation or acknowledged by such a huge
Organization. Fantastic. So before we jump into the questions that we prepared for you today, I mean, the conference this is a third day. Give a bit of feedback, like how has the conference been for you? How smooth was it? What's your takeaway for today?
Well, my takeaway, I'll start with the takeaway. I think they raised the bar so high for the next country to host this conference. It's always nice to have big conferences, but what's nicer is to see that every year you see something new.
Okay.
And this is actually what's happening in SWAC. Since it started until now, every year you will see something different than the next year. And it's an improvement. It's not just a different way of doing things, but it's an improvement. And people are learning, so they're taking this experience and going to their country and showing something different. And well, comparing to the other chapters where they're doing great, of course, job like Europe also, North America also, but you don't see that much of improvement or upgrading in the chapter like we're seeing here. 3 days of a conference, it's very tough to fill a scientific program of ECHO because it's a very specialized field.
Yeah.
So to have this amount of lectures to cover in 3 days, it's a very challenge. And I think they were up to this challenge because all the lectures that we attended was up to standard, and they're very scientific. They're up-to-date data. Nothing is repeated. We had excellent international speakers. I think one of also the big advantage of this conference was having the ECMONet and the SWAC ELSO at the same time. So we were lucky to have more than 20 international speakers, famous people from all around the world. And it's rare to have this number even in the other conference. So I'm saying they raised the bar so high, and I hope the other country, whoever it is, we're saying it's going to be India. But in India, hopefully they will raise the bar higher than that so they can give challenges to other people the years after.
Well, the Middle East is probably definitely proud.
That we are very proud. We are very proud.
Very good. So let's jump right into the questions. The first one is, how was your experience with the Cannulation workshop?
Yes, so I was part of the Cannulation workshop. Actually, before I talk about the Cannulation workshop, I am also proud of what's happening in Abu Dhabi as an ECMO program. And I was lucky and honored to be a small nucleus of starting the operation at the level of Abu Dhabi's healthcare sector, and sharing some of our experience in Saudi Arabia. But to be honest, it's time for us to learn from Abu Dhabi of what I'm seeing at this level. So this was a great success story for Abu Dhabi. And it goes back to what your question for me about the Cannulation here. So if you wanna succeed in something, you have to learn it appropriately first. So the education is the start of everything. And from education, you do two things. You create people who know the job and how to do it, but you also make sure that you make awareness, because people will start talking, oh, why are you guys learning this? And what are you doing this? What is ECMO?
Yes.
So it's not just the clinical people would be interested, it's even the non-clinical people, your administrator, your leaders. And these are very important people who support you. Without them, you cannot get things done. So I saw the Cannulation course, and And because of the awareness part, we saw a lot of people we would have not thought that they would come and attend such courses.
Wow.
From different fields of emergency medicine physician coming to candidate, yet still this is an ICU, ICU process or ICU procedure. But because now they hear about it, they're interested, they want to know more about it, and they're going to like the technical part of it. So that's just so that the education is a very strong tool of making people aware and involved in such a procedure. We had a 2-day course. It's a one day course, but because we had a lot of attendees and to be able to accommodate them, we split it to 2 days course. It was practical. It was fun. People were very engaged in the course. And to be honest, I went to a lot of cannulation course. One of the very strong advantage of this course was every attendee had to put hands on, and they were able to do it. So they had enough time to do that. So yeah, it was a great experience.
Oh, amazing, amazing. How many cannulations should one do before claiming to be an independent cannulator?
Good question. It's not about the number, it's about the number and the frequency. So I could do 100 cannulation, but then I stay for 5 years and not do, and then I will use the experience. So I think I would say, do you see that? Yeah, I would say somewhere between 30 to 40 annually. And if you keep on these skills, you'll be converged. So if I want to license someone for the first time and they went through training, I would say at least they have cannulated 20 times before I say yes, he is competent to cannulate by himself.
But when you say 20 times, does it have a time frame, like 20 times in a year?
Yeah, 20 times in a year.
Okay.
Yes.
Perfect. You have led the Saudi ECMO program over the years. Would you like to share your greatest learning point as an administrator and setting up this level of the program?
I think we touched on these things a little bit earlier, but again, it started as an idea. I had my first case in Saudi Arabia in 2018 or 2017 actually. And it was a successful story and I was very proud, and then I said, well, I don't have colleagues to share this proudness with, right? Because I am doing something and I don't know if there's other people around me who does the same business. So I started to reach to people and get to know them, and I was impressed that we actually had a group of physicians in Saudi Arabia who were interested in the same thing, and they were doing this, but nobody know about us. So we gathered and we started talking to each other, and we said, let's restart the same thing: education, awareness, marketing ourselves as leaders in this field. And then once we had this infrastructure of education, one of the key points, if you want to start a program, is you have to engage the leader in what you're doing, and you have to show them the benefit of that from the not just the medical point. Saving a life is the best thing on earth to do. However, there's a lot of logistics and a lot of finance that goes behind that. So a leader sometimes need to have some more persuasion rather than just saving a life. This is very important, but also it's important because of this and that. Your prestige, your finance actually is going to get better if we save them early rather than let them stay for a long time.
So it's not just the end result, it's like literally the full entire process.
Exactly. And also talking, and your hospital level goes up when you have a very strong service such as this. You will do bigger surgeries. You're going to have more advanced complex surgeries. So there is benefit from the hospital. And that's the second step where we try to talk to the leadership in our country and convince them that this is a service that is very needed and it will help a lot and will improve our care system. And we were lucky that we had people who listened to us and engaged with us. And we made sure that we all talk the same language. And even if we're different hospitals.
So there's unity, basically.
Exactly. So that is second step. Since you had the education and we are talking the same language and you have the leadership support, So you have to set the policies. You have to set the protocols. You say, this is the law. We should follow the law in these cases. And that was great. And this happened during the COVID era. The COVID era was happening while we were already organizing ourselves, and this is the way we're going to do business. And that helped a lot because we were all saying the same language. We were talking the same, so nobody's saying something different.
Yes.
And the collaborative work in the clinical and administrative work helped a lot. So we took a decision, we took it as one team and one person. And it was very supportive. If someone come and argue, well, it's 15 people said
yes,
or 15 people said no. It's a very strong recommendation when it comes like that. And then after that, the maintenance. So you have to assess even before maintenance. You have to assess what you're doing. So auditing of what you're doing. So looking at KPIs, looking at QPS, looking at numbers, auditing what you're doing. Am I doing it the right way or wrong? Where is the gaps that I have? And you keep on looking at these things and you fix these things,
improve,
and then use the media, use the social media or the news, or it's always nice to advertise what you're doing. It's not about becoming famous, but it's more. Some people will help you. The community will help you when they see it. So you'll have the empowerment also from the community. So the leadership is supporting you, but the community, when they empower something, it will support more to get what you want in the right way.
It has its commercial aspect, but this commercial aspect basically also helps with awareness.
Yes.
And then I wanted to ask you, the next question is, you have been a leader in SWAC for years and seen many conferences. Where do you place this year's conference? I know you've basically given it your thoughts.
Exactly.
But to sum it all up, and basically what you believe you'd like to see in India being in the conference in 2026, what are your thoughts?
To be fair also, because there's other countries that did a great job. I would say SWAC ELSO is top 4 conferences in the last 10 years. The level of organization, complexity, the multi-nationality, multi-communication from different countries, the exhibition support and the sponsorship companies supporting the conference is actually more than what I've seen in other conferences. That's a bit. India has a lot of experience, to be honest, and this will be probably the 4th conference in India, if I'm not. I think if I'm correct, and India, they have a lot of serious. What probably just what India need to add is the marketing part of the aspect of the conference. I think they depend on having a lot of local attendees rather than advertising international. I think if they did put the effort a little bit in the marketing part and do it early on, a lot of people will come. Again, India has a lot of tradition and a lot of nice places to go, but people don't know that.
They're not aware, yeah.
So they're not aware. So that's probably what they need to add.
And then last but not least, in terms of the industry that you're in,
yes,
what would be the highlight for you? Is it the education? Is it the industry? Is what brings life to you as an individual? Not saving the person's life, because of course at the end of the day, it's good to save the person's life, as you said. But what's the highlight for you in your life with this industry?
In the ECMO, you mean the ECMO industry, right? So what is my niche, or what do I want to put my passion?
Yes, what weight do you?
I would say on it. A lot, to be honest, a lot of phone calls. No, but I think I'm more passionate of getting involved with the industry to try as much as possible to get a new technology that is cheap. Technology is still expensive. And it's not easy to be afforded by a lot of people, and it causes a lot of burden on the system, on the patient, on the hospitals. So engaging with the technology, with the sponsor companies, and trying to find the best technology, that is my passion. hopefully get to a front point that we can get these machines cheap, like can be afforded by anybody.
Do you think AI will be able to contribute in
AI, I think AI is doing a lot of data transformation with AI is helping a lot. But I think it's more the pump itself, and trying to have pumps that are less expensive with the same efficiency that we have now, or the tubing. These are the things that I think we need to focus on, how to get a machine that is less complex and cheaper.
Thank you so much for your time.
My pleasure.
Thank you for the wealth of information.
My pleasure.
And hopefully we'll see you in India.
Inshallah. Hopefully we'll have the same interview again.
I hope so too. We definitely have more information to discuss back then.
Yes.